Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Cervical Artificial Disc. Introduction. Spinal discs in the neck can become damaged over time. This often causes pain, weakness, or numbness in the neck and arms, or numbness and weakness in the legs. Healthcare providers may recommend surgery to treat a diseased disc in the neck. If your healthcare provider recommends disc replacement surgery, the decision whether or not to have surgery is yours. This program will help you understand the benefits and risks of this operation. Anatomy. The spine is formed of solid bones called vertebrae. Vertebrae support the back and help a person stand up straight. The first 7 bones in the neck are called cervical vertebrae. The vertebrae are separated by softer cushions called discs. Discs absorb the impact on the vertebrae during activities such as walking and running. Discs also provide flexibility. They allow the neck to bend from side to side and front to back. Discs in the neck are called cervical discs. The spinal cord runs through an open space in the vertebrae. It reaches from your neck to your lower back. Nerves branch off the spinal cord. Nerves provide movement and sensation in the body. Symptoms and their causes. Discs in the neck and back wear out over time. This process happens naturally as we age. It is called disc degeneration. Degenerated discs can push on the nerves and spinal cord. This often causes pain, weakness, or numbness in the neck and arms, or numbness and weakness in the legs. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Alternative treatments. Using a cervical collar may help ease the symptoms of disc degeneration. Sometimes anti-inflammatory medications help with symptoms. These types of medications include steroids used on a short-term basis. Non-steroidal anti-inflammatory medications can be used on a longer-term basis. Spinal injections may relieve your symptoms. Physical therapy may help relieve symptoms. Traction could also be used. If non-surgical treatments have not improved the symptoms, surgery may help. Traditionally, surgeons remove the damaged disc and then join the 2 cervical vertebrae together. This is known as discectomy and fusion. With discectomy and fusion, the neck loses some of its natural range of motion. The discs above and below the fused vertebrae can also degenerate faster after the procedure. This can cause long-term problems. Cervical artificial disc surgery is an alternative to fusion. The surgeon replaces the damaged disc in the spine with a disc made of metal or a plastic-like material. The surgeon does not fuse the vertebrae. The spine usually has a greater range of motion after cervical artificial disc surgery than after fusion. This program discusses cervical artificial disc surgery. Before the procedure. Your healthcare provider may tell you to avoid food and drinks for a certain number of hours before the procedure. Your healthcare provider will give you instructions on showering before and after the operation. Before the surgery, tell your healthcare provider about any medications you are currently taking. You may need to stop taking certain medications before the procedure. The procedure. The operation is done under general anesthesia. This means you will be asleep during the procedure. The surgery may last a few hours. The disc is approached from the front of the neck. A healthcare provider will clean the skin on your neck. The surgeon will make an incision on the front or side of the neck. The surgeon will carefully move aside the important structures in the neck until they reach the spine. The surgeon will then remove the damaged disc between the vertebrae. Next, the surgeon will put a new man-made disc into the disc space. After the operation, the surgeon will close the incision with sutures and cover it with dressings. Risks and complications. The risks of surgery include those related to anesthesia, those related to surgery in general, and those related specifically to this procedure. Anesthesia is safe, but like any medicine, it can have risks. Complications of general anesthesia may include breathing problems, chipped teeth, cut lips, sore throat, headache, urine retention. Rarely, anesthesia may cause serious complications. These include lung infections, stroke, heart attack, death. Your anesthesiologist will talk to you before your surgery about these risks. They will ask about any medications you are currently taking. Blood clots in the legs can happen due to inactivity after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs. There they will cause shortness of breath, chest pain, and possibly death. Let your healthcare provider know right away if you experience symptoms of a blood clot. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of this complication. Surgery in general also comes with risks. Complications may include 1. Bleeding that happens during or after surgery. This is more likely if you are taking blood thinners. Bleeding may require a blood transfusion. 2. Infection, either deep in the tissue or at the skin level. 3. Skin scars that may be painful or unsightly. Other risks and complications are related specifically to this surgery. These are also rare, but it is important to know about them. The feeding tube or esophagus could be injured, causing swallowing problems. The breathing tube or trachea can also be injured, causing breathing problems. The vocal cords could be injured, causing hoarseness of the voice. The carotid or vertebral arteries could also be injured. The spinal cord and nerves could be injured, resulting in stroke, paralysis, weakness, and decreased sensation involving the arms, legs, or the whole body. In rare cases, sexual dysfunction may occur. This can be temporary or permanent. Fluid may leak from around the nerves or spinal cord. There is also the possibility that the operation may not help the symptoms and may even make them worse. The artificial disc may break, loosen, or become damaged during or after the surgery. If this happens, another surgery may be required. After the procedure, your healthcare provider will tell you how long you will stay in the hospital after surgery. Patients usually go home within 2 days. Your healthcare provider may give you a cervical collar to wear after surgery. They will tell you how long you must wear the collar. You may start physical therapy after the operation to help you recover and resume your previous activities. Your healthcare provider will tell you when you can return to work and to your normal activities. This usually takes about 4 to 6 weeks. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Discs in the neck and back wear out over time. This process happens naturally as we age. It is called disc degeneration. Degenerated discs can push on the nerves and spinal cord. This often causes pain, weakness, or numbness in the neck and arms, or numbness and weakness in the legs. If non-surgical treatments have not improved symptoms, surgery may help. Traditionally, surgeons remove the damaged disc and then join the two cervical vertebrae together. This is known as discectomy and fusion. Cervical artificial disc surgery is an alternative to discectomy and fusion. The surgeon replaces the damaged disc in the spine with a disc made of metal or a plastic-like material. The surgeon does not join the vertebrae. The spine usually has a greater range of motion after cervical artificial disc surgery than after discectomy and fusion. The operation is done under general anesthesia. This means you will be asleep during the procedure. The surgery may last a few hours. You may start physical therapy after the operation to help you recover and resume your previous activities. Your healthcare provider will tell you when you can return to work and to your normal activities. This usually takes about 4 to 6 weeks. Thank you for using Explain.